Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of Kidney Coach and Kaigenesis, a range of supplements designed for people diagnosed with chronic kidney disease, whether you have a low EGFR, although that may not be as much as we think after Lindsey and I have just been chatting before this podcast, or a high creatinine level, or maybe a cystatin C that doesn't look like it should. We might have a supplement for you. Cystatin C, I think we just have to go there now, Lindsey.
We can talk about that in that whole thing. Yeah, it all goes
Yeah,
together.
yeah. Oh, and I digress. I'm sorry. Lindsay and I were chatting away about she's had a whole pile of patients thinking they're in renal failure and they're really not. So we were discussing what actually kidney disease is, what parameters look like. Does an EGFR actually, is it as reliable as we think it is? I get a whole pile of patients on creatine supplements with their a
Mm.
low EGFR because their creatinine's high, because they're obviously taking endogenous stuff. You get them to stop, the kidney functions fine. So we'll do a whole other podcast on that, but that is not for today. So I'm joined again today by the wonderful, the fabulous, the ever so wonderful person that I love to banter with, the beautiful Lindsey Zirker. Lindsey is a renal dietitian at Kidney Nutritional Institute. She has a lot of expertise in dialysis and working with people with end-stage kidney disease, as well as working with patients who want to know the cause of their disease, nutrigenomics, epigenetic expression, and all of that good stuff. Lindsey is a published author, clinician, and all-round brainiac that I like to pick her brains with. And we have finished our mineral series. We did hormones as well, although we need to come back and do one that I've just gone down the rabbit hole with. But today we're starting vitamins. So the first one we wanted to start with was the wonderful, the fabulous vitamin C. I feel like that was a really big introduction, Lindsay, and I went all over the place because we were chatting before I hit record, and I didn't fall off my soapbox in time.
We should have just switched over to that other topic today
I know,
to
I actually thought I might, we should record about that topic because it's such a good one. We will do that next
yeah,
time. I
yeah,
feel like that one actually needs a microphone for sure.
yeah. Mhm.
But we're not. We're going to talk about vitamin C because you've been doing the research, and I feel like it's really. I actually nearly said to you, let's switch topics, but you've researched this one, so let's do this. So tell me, all things vitamin C. So first off, let's start with what vitamin C is, and then we'll get into its roles in the body, links to kidney disease, foods, testing, deficiencies, and all that good stuff.
Yes. So, vitamin C sometimes also gets called ascorbic acid. It was actually discovered not that long ago, really, 1928. So,
Yeah,
hasn't
right.
really, yeah, we haven't really known too much about it for that long. So, interestingly, most mammals can make vitamin C on their own, but humans don't have the last enzyme in the vitamin C production path. So, we are really dependent on dietary sources.
Along with
Um,
guinea pigs, right? It's us and guinea pigs that can't make vitamin C. Is that right?
I just like saw most mammals, so I didn't,
Yeah, I'm pretty sure guinea
dig.
pigs are one that don't make it either, from memory.
Oh, yeah. So yeah, you got to have it from the diet. And if you have a guinea pig, make sure you're giving them a vitamin C rich diet. Um, it also doesn't last very long in the body. So your body can't really stockpile it. So you have to be pretty consistent with your intake to maintain adequate levels. Um, it is destroyed by light, heat, oxidation, and alkaline solutions. Um, and you absorb it pretty well from most sources, like 70 to 90%, but the amount that is absorbed will decrease as your intake increases. So your body kind of has a naturally built-in, um, you know, feedback system so you don't overdo it most of the time. Most of the vitamin C is stored in the adrenal and pituitary glands. Vitamin C in really high intakes, it can interfere with some lab tests. So we might get into that later, all the details when we talk about dosing and stuff. Um, But vitamin C is an amazing antioxidant. It plays all kinds of important roles in the body, like with collagen synthesis and healing tissues, carnitine synthesis, neurotransmitter and hormone synthesis, helps with iron absorption, and helps with tyrosine, the amino acid tyrosine synthesis and catabolism. So it does a lot of different things in the body that are pretty important.
Has a big role in the immune system too, right? Hence why everybody takes good old
Yes,
vitamin C and they get sick.
yes, the immune system. How did I leave that one off my list? Um, yeah, definitely important role with the immune system.
Yeah. So, how common is a vitamin C deficiency in the modern Western diet? I mean, we're not all at
Um,
sea sailors with scurvy, so everybody knows that's the. Is that how it was discovered? Like it was the scurvy thing when people, were going to sea. That sort of fits with 1928 sailors going out. Is that part of that?
yeah, I mean, definitely that's why if you read like historical fiction or, actual history from, time when in the late 1800s, I think, a lot of times the sailors were called limeys because they would put limes on board the ship to help prevent scurvy. So they would get, yeah, vitamin C from that. So, vitamin C deficiency, you know, I I'm trying to see if I actually put the deficiency numbers in here in my notes, but I'm starting to get a little bit suspicious of
No, Lindsay.
I'm getting really suspicious about when they look at population data and they're saying like deficiency levels are, XYZ. Um, uh, because the way that vitamins are typically assessed is by looking at how much levels of it are in the blood. And
Mm,
for the vast majority of vitamins and even minerals, that's just really not an accurate way to assess it because, like, all the reasons, right? Like, is like vitamin C always in the blood or is it in other tissues or the other cells? And is it, how do we know that this person has this amount, but do we know that that's actually enough for that person?
yeah.
Um, and so I feel like deficiency of nutrients, I can't even say if it's underreported or overreported because I just feel like we haven't really come up with consistent good methods for most of the nutrients to assess by just like a blood draw or something that's relatively, simple.
Yeah.
I don't know. I feel like we just don't really do a good job of that yet.
No,
Um,
we don't. And the organic acid test tests it in almost all my patients deficient in vitamin
mhm.
C. But
Yeah.
when I spoke to the labs, they're like, it oxidizes so fast, that's not a reliable test either. So I'm like,
Yep.
okay. They're like, we can't count that one really. They're like, you'll see everyone be deficient. I'm like, which is what I see. So,
Yeah. And again, yeah, the half-life of it is really short. And so if a person has like high amounts of inflammation or oxidative stress, of course they have a higher vitamin C need, but like again, like blood levels, it's gonna be weird. I don't know. Yeah. So, but I think like generally speaking, it seems like it's a common enough deficiency. It's not a super weird one. In the general population, they kind of estimate that maybe like close to 20% might be actually deficient, where up to 40% are insufficient.
yeah,
Um,
right. That's nearly half the
yeah.
population. That's more than I thought, being that that tells me how many people aren't eating their fresh fruit and vegetables.
Yeah. Yeah. So, in the kidney population, um, it is especially in like later stages, so like stage 5 and on dialysis, they estimate that uh, not on dialysis, at least 50%, but probably more. And then for dialysis patients, 80% are vitamin C um,
Wow.
insufficient or deficient, even when taking supplements.
Well, that tells you how important it is and how much the body's chomping it up, huh?
Yeah, well, there's a lot of reasons, especially for like dialysis, why they're low. But that whole potassium restriction, I feel like that has been such a, um, I feel like that's been such a harmful recommendation. Like the more that we understand like what's really driving what's going on with kidney disease, the restriction of all those fruits and vegetables with all their antioxidants and fiber and nutrients and alkalining minerals, I just feel like that was a major disservice for our CKD population.
Totally. You know how I feel about it. I totally agree with that. And I know the guidelines have changed around that, and we've been saying on these podcasts with you and Jessiana that you shouldn't restrict potassium unless you have elevated potassium on a blood draw, and more than once, because we know even just a tight tourniquet will give you a false
Yeah.
spike in potassium level. I totally agree with you, Lindsay, because obviously all those potassium-rich vegetables have got all the other stuff that we want to get in for kidney disease.
Hmm.
So, vitamin C, why do we care about it in kidney disease? What does it do? What does it protect against? And why are our kidney guys so deficient in it?
Yeah, so I mean, vitamin C, like we talked about, has all these really important functions. So when we think about the different things that, our dialysis patients are dealing with, or that our CKD not on dialysis patients are dealing with, um, vitamin C is really important. We know that inflammation's a big deal, and since vitamin C is a great antioxidant, um, that it's really important to have on hand to help with that, because it also helps reduce inflammation and it also helps increase iron absorption, plays a really helpful role in anemia, not only iron deficiency anemia, but also like EPO deficient anemia or anemia of chronic disease, because your body is not really going to let you absorb very much iron when you're really inflamed, because iron will act like the pyromaniac child it is and set fires everywhere. So,
It
yeah.
will.
So, and like healing tissue, collagen synthesis, um, there's so much discussion around how like people on kidney disease, they age prematurely. And obviously a part of that is the clotho, which we've talked a little bit about. But I think another part of it is just the high taxing amount of inflammation. And so, like, it's a high tax on vitamin C and your other antioxidants. And so, the skin is going to suffer for that and going to look kind of older when that happens. Um, yeah. Um, but yeah, immune support is super important, because we have kidney patients. A lot of times their immune system is simultaneously upregulated because of the inflammation and also suppressed. So vitamin C is really important for that. Um, and periodontal disease is also something that is pretty common. And people who have low vitamin C levels seem to have more severe periodontal disease. And especially if you have diabetes on top of that, um, that's another increased risk.
And I'll add to that if you're a smoker, because we know smoking absolutely
Yeah.
taxes draws on your vitamin C reserve. So I have had patients with smoker, severe vitamin C, periodontal disease, and yeah,
Mhm.
vitamin C is a big part of that pathway for them too.
Yeah. Yeah. Um, Wound healing, it's not like the only factor, but clearly playing a role there. And also for gout and other like just random stuff that even if you didn't have kidney disease, you don't want to deal with, like uh, age-related macular degeneration.
Yep.
Um,
No.
Interestingly, AFib. some of the
Mhm.
research has showed that AFib can be triggered by really stressful conditions like kidney disease or even dialysis, but also cardiac operations. This study that I looked at said that about 30% of patients can experience postoperative AFib, and AFib is associated with oxidative stress. And so they found that if they provided vitamin C before the surgery and after the surgery, that it reduced incidence of AFib. And so
Okay, that's cool.
that's, yeah. So, yeah, learning about that made me like really curious because high potassium, contributes to AFib. That's the reason why everyone freaks out about it. And I was like, well, what if the AFib isn't necessarily related to the high potassium, but it's related to the oxidative stress?
And the low vitamin C. Yeah, fascinating.
I
Didn't
don't
hear
know.
any, don't know
Yeah.
either.
Yeah.
Correlation doesn't mean causation, right?
But it's just good to recognize that our body, like, there's no systems that really act in a silo. Like, it's the whole network. And so for some people, nope, that's definitely not really playing a role. For other people, it could be a huge contributing factor. So it's really just kind of helpful to cast a wide net to, see what could possibly be the best option.
Yeah, fascinating. Okay, so if someone was deficient in vitamin C, what sort of symptoms would we be looking for?
Yes. So, some of the symptoms that we hear, like the most kind of classic symptoms, those ones may not really show up until like serious
Yeah.
things are going on. Um, so the really serious symptoms, they're when you're trying to remember them, they're called the four H's. So you're looking for hemorrhagic signs. You're looking for hyperkeratosis of hair, so like weird hair stuff going on, hypochondriasis, and hematologic abnormalities. So kind of a lot of weird words in there, but basically, um, you are gonna see corkscrew hairs, so like on the arms and stuff, gonna be really wiggly looking hair. Um, you're gonna have um, uh, poor wound healing, like bruises that take forever to heal, or really easy bruising. A really specific type of skin discoloration called petechiae, where like around the hair follicle, you get like this like red kind of, it looks like red dots, but it's just red ring kind of around the hair follicles, right? Um, Swollen and bleeding gums, loose tooth, those kind of things. I think those are like the really like big ones that happen later stage. You can also have altered mental status, depression, anxiety, mood disorders. Um, so those are late ones. But earlier symptoms that are more nonspecific, fatigue, weakness, irritability, joint and general pain, those are all like it's hard because those are very nonspecific. I mean, but those are common symptoms that um, people might see with vitamin C deficiency. Any other ones that you see?
No, I'm thinking, like I often see the big times I see it are, people who are immune compromised or, poor dietary sort of stuff and things like kidney disease where they might be restricting certain foods. My chronic fatigue patients, like you mentioned, the adrenal glands, the major food, and you said, most of it's stored there. The major
Yep.
food of the adrenal glands is vitamin C. And I will say perimenopausal women, because what happens is as your ovaries shut down, your adrenal glands, before the fat cells will actually take over production of estrogen for a short period of time. And so if you're vitamin C deficient and the adrenal glands don't have enough, or as you move and shift through that, the adrenal glands are going to chomp through more vitamin C as women move
Mm.
into that. I think I know just the joint pain and stuff that women get, the frozen shoulder, is also low hormones, but I
Mm.
think vitamin C plays a role in that with the collagen synthesis and all of those sort of things as well, because your body seems to need more vitamin C in that perimenopausal shift because the adrenal glands take over that, especially if you're a lean bean like me that doesn't have a lot of visceral fat. That's the other sort of organ that will produce a lot of estrogen. So if you don't have a lot of visceral fat, you're highly reliant on healthy adrenal gland function. So, and they will just absolutely burn through more vitamin C during that time. So,
Yeah.
yeah, there are times I look out for it. But yeah, symptom wise, the fatigue, the poor, slow wound healing, like you mentioned. Yeah, and then obviously the really big ones, bleeding gums.
Yeah.
Yeah, that'd be another one. But yeah, you're right. They're very sort of non-specific sort of
Yeah.
symptoms,
It's
and it's hard,
difficult.
yeah, and it's hard to test. You really just have to look at dietary intake and then figure out if they're burning through a lot of vitamin C. Because in Western world, if you are assuming people are eating a good variety of fruits and vegetables and things like that, vitamin C often isn't a first one that I'd be thinking about. I'm generally nuanced to zinc and things like that, but yeah, as soon
Right.
as people say they're bruising all the time, they've got some bleeding gums, they're a little bit fatigued, I'm like, vitamin C.
Yeah.
So,
One of the things too I was thinking about when you were talking about the hormones is that you need vitamin C to help convert T4 to T3 for your thyroid. And so, especially patients, if you're on a T4 only medication and you're vitamin C insufficient, then that's going to make your thyroid medication not be as effective. So that's something that kind of, like you said, I'm not always necessarily thinking about vitamin C, but there's a few things that I'm thinking, oh, like smoking, um,
it's a big one.
or just like general malabsorption, those kind of things. I'm just like kind of thinking about all of the nutrients, but definitely with thyroid, thinking about that too.
Yeah, no, it's a really good point. Yeah, it's a sneaky one. And okay,
Hmm.
so supplement wise, let's do foods first, then supplements, because supplementing I find with vitamin C is a nuanced and interesting thing to do. I love
Yeah.
giving I love giving people diarrhea. It's my favorite thing to do, not. So let's first talk about foods that are high in vitamin C, and then we can talk about how we give people diarrhea by giving them too much vitamin C.
So, what I try to do when I'm looking at what foods are the highest in vitamin C, a lot of the food lists are going to say, oh, eat these foods, they're high in vitamin C because they're looking at how much vitamin C per like 100 grams. And I just feel like that's not very helpful because I don't really think about food in grams, and so I don't really know what that means. And sometimes 100 grams is just like a weird portion size, like it's not very reality based. So when I looked at the different foods that were high in vitamin C, I try to put it in kind of like normal-ish portion sizes. And you want to know, do you want to take a guess at maybe, the top five foods?
Kiwi fruit?
Kiwi, one fruit, has 64 milligrams of vitamin C per serving. So it definitely has some in there. That's 71% of the daily value.
Okay.
So
Did it
that's
make
a
it
good
into the
amount.
top? Did it make it into the top five highest? No.
No, I know. It's an on-the-spot quiz. It's not very
I
fair, but
love it. No, it's good. It's good. I mean, I know the ones that I know don't have, like oranges that people think, and then, but no, they sit in warehouses forever before they actually ship out and get to you. So by the time people are eating oranges, they've got like no vitamin C in them. Um, I'm going to go, there's going to be a green leafy in there because green leafies love to just, like be the king of everything because they like to pop out on top and go, hello, we're like hide everything. So I don't know, there's going to be, what's some random green leafy vegetable that can come through with the goods that isn't high in oxalates? I don't know, but broccoli, it's not one that I would ever say is high in vitamin C, but I'm just going sideways now with stuff.
I know. One cup raw has 90% of the daily value. So it has more than a kiwi. If it's raw,
Okay.
because remember, like,
Yep.
heat is going to take some away. I mean, it depends on the cooking method. of how much. Like boiling is like the worst. You're just gonna like lose most of the vitamin C. But like sauteing or steaming, you're still gonna retain, like 80% of the vitamin C
Okay. What
most
about
of the
our
time.
cranberries and cherries and things like that? Those nice little.
So
Not because
cranberries,
sitting down and eating a whole pile of cranberries. It's not really useful, but
yeah, I didn't actually put those on my list like anywhere.
yes, I'm failing.
Okay.
You just
So
tell me, Lindsay, tell me.
I'm gonna just tell you. So actually, most peppers, they have good amounts of
I did
vitamin
know
C.
that one. Why am I actually know
I
that
knew
one.
that
Yeah,
you knew it. Yeah, I knew you knew it.
yeah,
So
I actually
bell
know that
pepper,
one. Yeah.
yeah, sweet red bell pepper raw, 1 cup of that, 190 milligrams. So that's 211% of the daily value.
That's why I eat raw bell peppers every day. Yes, of course.
Yeah,
Duh.
fantastic. Um, the top one that I found was guava. Cup
Wouldn't
of
know.
guava is
There you go.
377 milligrams,
Do you get
which
guavas native over there?
no. I
I'm like there. Fiji, sure.
Yeah, so I don't typically put that on my food list. I'm typically like, okay, let's look at red peppers, um, or green peppers. They've got a little less than red, but they're still good. Oranges have, about, depending again, like you mentioned, how
They have to come off a
old they
tree, is
are.
my understanding.
Yeah. But strawberries aren't bad either.
Mhm.
Papaya, pineapple, especially if you do happen to be one of those people that has to watch the potassium, like pineapple and broccoli, are really good options. Brussels sprouts was the vegetable that actually really surprised me the most, with a cup of Brussels sprouts raw being 74 milligrams of vitamin C.
There you go. See, I knew it'd be something disgusting. I
I
was like,
know.
okay, kale is going to be. And I love Brussels sprouts, so I shouldn't say they're disgusting. But for most people, they're like, nah.
You gotta roast them. That's what I found. I didn't like them until I had them
You got to
roasted.
roast them with coconut oil and put bacon on them, and then they're fabulous.
And also maybe a dash of balsamic vinegar.
Yep. Now you're
Yes.
talking. Yeah, that's how you make Brussels sprouts. I make the best, but yeah, they've got a little bit of
Hmm.
bacon put over the top, and they're cooked in coconut oil, so they're crunchy.
Delightful. Yeah, the crunchiness, that's
Absolutely.
good.
Yeah.
Yeah. So, I mean, the good news is that vitamin C, there's some amount in most plant foods, right?
Yeah.
So that's the positive thing. Like, you don't have to have guava to like get your vitamin C dose in for the day. You can have lots of small doses throughout the day and get a good amount a lot of the time. There can be some other reasons why maybe you wouldn't get enough through diet, but it's if you just kind of pay attention, then you can get it in a lot of times. So that's the positive thing with food
Yeah.
sources.
I always say to patients, if you're eating a good percentage of raw fruit and vegetables, I mean, because I do so much autoimmune stuff, my autoimmune guys are on 9 cups of raw fruit or not or lightly cooked fruit and vegetable a day. They're hitting their mark on vitamin C. So,
Yeah. Hmm.
but if you're boiling, you're right. If you're boiling everything to an inch of its life, or you're doing frozen or packeted stuff, or if you're not eating seasonally or local, because vitamin C is so unstable. If you've
It
shipped
is.
something in from Jamaica, or you've got your guava that's come across from Fiji. I don't. Maybe guava's a bit better, but I remember reading a study about oranges, and by the time oranges they pick them green, sit them in a warehouse, and by the time even in Australia, where they're native here, we get them, the vitamin C content had dropped by 85%. It was crazy. By the time they're on the supermarket.
Whoa.
Yeah.
That's amazing. I didn't realize it was that much. That's
Yeah,
crazy.
it's bonkers. So it's like, yeah, you don't actually get good quality vitamin C from that. So um, that's where the whole eating seasonally and local and all of those kind of things and not doing the supermarket stuff and going to farmers markets, those foods are going to be much higher in available vitamin C. So, yeah.
Hmm. Yeah.
Okay. And if people want to supplement, because vitamin C, does go in supplements, it is a supplement we recommend in stage 1 of our kidney disease protocols because of the effect that vitamin C has on stabilizing endothelial tissue. So it helps reduce the fibrotic processes happening in the kidneys. That's why we love it so much and been a really powerful antioxidant. Talk to me about supplementing it because it comes in quite a few different forms.
Yes. So, I've definitely seen quite a few different forms. Initially, I was doing the literature for it. It was kind of like, you know what, it's sixes, whatever kind of form you want to use for vitamin C. But I think that, there's some other options that might rise to the top. Do you have a favorite form of vitamin C, Fiona?
No, well, it depends on the individual. Ascorbic acid, if people aren't highly acidic and things like that, is generally the one I'm going for. Calcium carbonate or calcium ascorbate, maybe as
Mhm.
well. You get a bit of calcium in there too. People don't tend to react to that one if they can't do the acidy sort of load on it. They're the most
Hmm.
common ones in all the supplements that
Yeah.
we've.
Hmm.
And then liposomal vitamin C, if you've got someone
Yeah.
massively, like if you think, okay, I want to get vitamin C across fatty lipid membranes, I want it inside cellular sort of structures and things like that. Maybe I want more of that action. I would go for that. I do, and I also recommend IVing vitamin C a lot, which they're using ascorbic acid in IVs, is my understanding, right? So,
Yeah, that's what I had found as well. Yeah, those were the ones that I came across too. And like the liposomal is like the most bioavailable, but ascorbic acid also gets the job done really well most of the time.
yeah,
Yeah.
yeah. Dosage and how to dose it, because there is a nuance here.
Oh, yeah. So, this is the thing for kidney disease. So, or just like anytime you're looking at it, at least for myself, depends on what kind of data you have, I feel like that kind of helps guide your decision. So, like if I have patients filling out food logs, so I'm able to look at things in chronometer and I'm seeing like estimated milligrams a day of what they're getting, that kind of helps, me see based on how much I think they need versus how much it looks like they're getting, can we do this with food or would a supplement be a better option? The other thing I look at is their symptoms. Like, do I feel like any of these certain symptoms are their body saying, hey, please send us some vitamin C? And also I'm looking at risk factors for vitamin C inadequacy or deficiency. And for our CKD patients, definitely inflammation is a big factor. General, like any kind of malabsorptive disorder. So any kind of like, inflammatory gut issues. Again, I feel like that's a lot of our population. Hypo or hyperthyroidism. Um, and then if they're on dialysis, it's estimated that on average, a hemodialysis treatment removes about 66 milligrams of vitamin C. There's, a wide range of how much they think it can remove. And then on peritoneal dialysis, 29 milligrams per exchange. And sometimes people are doing like three exchanges.
Yeah, right.
And so I thought it was really interesting when the KDIGO guidelines came out, that they didn't, say, hey, because vitamin C is removed on dialysis, people with dialysis or on dialysis have a higher vitamin C need. They didn't say that, like even as opinion. They didn't even talk about removal of any of the vitamins on dialysis, which I thought was really curious.
Because
Um,
I think we talked about this before we hit record, right? What was the deficiency rate in dialysis patients? It was bonkers.
over 80%, I
Yeah.
think. Yeah. And for insufficiency or deficiency. But either way, and the data I looked at again for dialysis patients, the average intake was about 66 milligrams.
Oh, that's scary.
So
That's been all
it's
100%
like,
removed.
yeah.
That's
And
curious that
so
wasn't spoken about.
yeah, so I thought it was weird. Um, Also, I saw some data that showed that there's decreased reabsorption of vitamin C from the kidneys.
Mm,
So that could cause an increased need for people who have kidney disease, depending on where the kidney damage is at. The increased amount of oxidative stress or inflammation. So again, if I've, done some advanced testing, with organic acids and stuff and able to see like they have a high oxidative stress load or inflammatory load, then I'm definitely going to want to recommend more than that SAD RDA level. But I feel like it's really reasonable to say that people who have inflammatory chronic diseases are going to need more than, the 90 milligrams a day.
mm.
It's just not quite going to cut it. Um, and so, yeah, so that's kind of what I'm looking at if I'm deciding how much vitamin C does this person need. Now, if we have done blood tests where we actually, see, oh, your blood test shows us that you actually are deficient or insufficient, um, then, there's different dosing recommended for that. Um, they recommend for the first 2 to 3 days, the person gets 1 to 2 grams of vitamin C. And then for the next week, they get 500 milligrams. And then for the next 3 months, 100 milligrams. That's just the supplement. They're still recommending a higher vitamin C diet on top of that.
Yeah.
And then they're going to be monitoring the symptoms for that. So, if someone is like already has lots of known risks for vitamin C, a lot of the literature supports between 100 to 200 milligrams a day for supplementing. Now, of course, there's some other types of really specific therapy that vitamin C is used for. Um, and if you're using like IV, then, you got different dosing there. But that's kind of what I'm looking at. And um, a lot of times just, aiming for between that 100 to 200 milligrams a day is typical unless there's a specific type of therapy that we're doing. How about you for your patients?
Oh, as Australians, we dose quite a bit higher than that. So if you've got a cold or flu coming on, we'll dose anywhere from 1 to 4 grams. But
Yeah.
we split dose because vitamin C in a high dose, because as you mentioned, can only the bowels, it's absorbed in the small intestine, and it can only absorb a certain amount at a time, and it will cause diarrhea. So what we tend to do is to figure out where people's vitamin C needs as we go to what we call bowel tolerance. So we actually check what the body's response is. So if I thought someone was vitamin C deficient, I'd get a powder and I'd dose 1 to 200 milligrams every 2 hours until the gut starts to rumble. We haven't caused
Mm.
diarrhea yet, and we go, you hit bowel tolerance. So say they got to say 600, 700 before the bowels are like, and the person's like, whoa, we're like, stop. And then they take that dose over the next day and split it over the whole day. They do that for 3 or 4 days, and then they decrease by 100 milligrams every 3 or 4 days. And then you get back down to the 1 to 2 sort of 100 milligrams generally after about, it can take up to 2 weeks if someone's really deficient. If I think someone is super deficient, I quite like IVing vitamin C because you don't have the bowel tolerance issue. Some people, especially in Australia these days, the IV thing is quite popular. My IV nurse comes out and runs, I run vitamin C because I've got an autoimmune disease, so I run big doses once every 6 weeks along with glutathione and just those two actually, and some ALA. She says to me like, oh, after the weekends, we're flat out just, running IVs for people that have drunk too much or they need to rehydrate. Or coming into cold or flu season, people will run vitamin C, zinc and glutathione and things like that. So
Yeah.
if someone doesn't have the ability to sit at home and wait for their bowels to grumble or they're out and about, then I might IV them instead and then put them on a lower dose as a maintenance behind it. But that's generally what I do. But definitely winter season and things like that, we might dose right up to sort of 2 to 4 grams, just depending what someone's bowel tolerance is. I've got a decently high bowel tolerance for vitamin C because it is a nutrient for whatever reason my body burns through very quickly. So
Yeah, I feel like autoimmune might have something to do with that.
I think so. My body's like, ooh, vitamin C.
Oh yeah, I feel like my body's the same way. It
Yeah.
definitely loves the vitamin C.
Yeah.
So so yeah, I definitely agree with the colds, definitely those bigger doses, but those are pretty short term. And I think
Oh, yeah, yeah,
for
they're very short term, yeah.
yeah, like and even the literature kind of looking at it's like, these higher doses, especially if it's less for 7 days, it typically is not going to raise oxalate levels high enough or quickly enough to cause any damage. But that's just kind of based on their best guess. They don't have lots of studies really looking at that.
So that's a great point. So there is a big debate that taking ascorbic acid, vitamin C, in that form will increase the risk of oxalate kidney stones. I have gone through those studies in a lot of detail, and it seems to be one study that was very badly done that just becomes a bit like the potassium guides, becomes the spokeschild for all of this stuff. And when you actually go back and find the original study, you see it was done on rats, and they were given like 50,000 times the dose and all of this stuff. There isn't a study done on men, but again, it was, oh, was it 2 to 5 grams? They were giving them over an extended period of time, I think, and that did have a rise, but I'm pretty sure the dosage was off and it was only men. But when I really dug into the literature, I don't really see long-term dosing of vitamin C when done properly causing oxalate issues. In fact, like I say, we use vitamin C. It's quite a standard part of our process in kidney disease because of its effect on endothelial tissue. But I'd love to hear your thoughts on what you found in literature, because you are the queen of digging through literature and looking at the quality of studies. You do that better than anyone else I know.
I just have a compulsion, I think. I'm just like, but what about this? But yeah, the oxalate issue, I mean, I feel like this is just one of the things that was a concern, kind of like when we were talking about when we first started, that when dialysis is kind of a new therapy and like understanding what's all going on with the kidneys, what's causing harm, what's not, that there's a lot of stuff that they kind of saw early on. And then as medications improved, as therapies improved, dialysis has improved, that a lot of those things have become less of a concern. So with oxalates, the idea is that when ascorbic acid or vitamin C is metabolized, it gets the oxalate is one of those byproducts, and that typically the kidneys can excrete this, but in kidney disease they can't, and that oxalate buildup can cause kidney damage. Um, and they call that oxalate nephropathy. But oxalate is not really that straightforward. So, like in this, we're looking specifically at the pathway of vitamin C metabolizing to oxalates. And then there's also oxalate absorption from foods, which these are really different pathways. And so I feel like that's kind of important to keep in mind because there's different things you can do to reduce oxalate absorption um, outside of cutting out oxalate foods, which is just madness because none of that data makes any sense. So, what I found when I was looking at the studies is, yeah, that concern, people are worried about getting oxalate nephropathy. It is a rare thing, but in those rare instances, more than 50% of those cases require dialysis. So that's why it was, it's a big deal. But the most common causes of oxalate nephropathy, 88% of them were fat malabsorption.
Yeah.
So that's talking about kind of the other thing of how do we like reduce oxalate absorption from the gut? Not necessarily, we're not talking about vitamin C breakdown. Um, and the other one was excessive oxalate consumption. So that was like 20%. So that leaves like what percentage left for vitamin C? Like uh
One or
less,
two.
like nothing. And
Nothing, yeah.
so that's, kind of the research on that. So the meta-analysis that I looked at, it was a Cochrane review done in 2019. No, just a systematic review and meta-analysis, not a Cochrane review. They looked at a bunch of different studies published from 1996 to 2016. and they said if men have doses uh, greater than no, it was weird. They broke it down. If they're between 250 to 499 a day milligrams, or if they're from 1,000 to 1,500 milligrams a day, then they have an increased risk of kidney stones from oxalates.
Mm-hmm.
But if it's between 500 and 99 milligrams a day, then they're fine. And I was
Mm-hmm.
like, what kind of weird data is this?
This is where I went
Um,
as well. I was like, huh?
and I was just like, this is getting really convoluted. So other studies that I looked at, they're like, look, in the kidney community, still being conservative, if you have less than 500 milligrams a day, and especially if you don't have, a history of kidney stones or other things that are gonna, put you at risk for increased oxalate absorption, um, that's not gonna be a problem. It
Mhm.
wasn't until you got over that threshold of 500
Yeah, it was a big
milligrams a day that you're going to increase oxalate levels. And so I thought a lot of the times, like people really aren't going to need more than that. And in the
no,
times like
and
for
no,
colds and stuff, I mean, that's just a short amount of time.
like 3 to
So
4 days, yeah.
I was like, that's a huge difference between never take vitamin C and don't eat these vitamin C foods to, yeah, have less than 500 milligrams a day. And that's why it's so important to have a healthcare provider assess you and say, hey, what do you need? And recommend that. Um, so yeah, I just thought it's it's not really that hard to find in the literature, but these kind of myths get passed down. And then, you know, back in the day, the forms of dialysis, they weren't very good at removing oxalates, and so there was lots of, documented cases of high oxalate after vitamin C supplementation. But currently with hemodialysis, you know, it's more efficient at getting rid of oxalate. So even on dialysis, the doctors might freak out a little bit, but the reality is that doses of less than 500 for most people, if they need that high, it's not going to be a problem most of the time.
And most people can't tolerate, like I say, bowel tolerance
Yeah,
is such
yeah,
a fascinating thing. Once you've got your vitamin C sorted, which is what we might do in someone, is we will figure out the dose to the bowels rumble and then work back to get what we
hmm
call the bowel tolerance, or a working level that the body can absorb. Most people sit once they've figured all of that out and they've done it for maybe, a week or so to get their levels right. You
yeah,
might say 1 to 2 grams the first couple of days, and then you come down very quickly, or say 700.
yeah,
And then generally by like day 4 or 5, people cannot tolerate more. Once their levels are up, they're taking about anywhere from 100 to 300. And that's a very happy spot. More than that, people are going to be on the toilet anyway. So
yeah, exactly.
it's very hard to get those great big doses. And then unless you IV, like I tend to do. But haven't seen literature on IV vitamin C causing stones. But I did have a quick look, but I'd never seen that. It was more from the supplementation. I hadn't seen one where they were talking about IV.
I saw one for Um, there was a study where they did IV vitamin C,
Mhm.
500 milligrams, but it was only 3 times a week in
Right.
hemodialysis patients. They reported no high oxalate levels. Um, so it was one study and it was only 3 times a week, not daily. And again, 500 milligrams is not a crazy level. So yeah.
Most of the
So
IV.
yeah, I just feel like a lot of that fear around vitamin C it's just, left over from the past, and we just need to move past it and embrace all the great things that vitamin C can do for our patients, for people with CKD.
Yeah, like you say, it's not one I generally reach for unless I've got maybe a smoker, bleeding gums, or I've got my chronic autoimmune guys that have got chronic inflammation. Then it is one I think of in those cases. But the general population, as long as they're eating their fresh fruit and veg and getting their bell peppers and their guava in, then yeah, it's not one that I'm flagging generally, unless it's a sort of slightly different population. So Interesting. All right, before we wrap up, any last words of wisdom you want to say about vitamin C?
I think I would just add like with antioxidants in general, because vitamin C is an antioxidant. You just want to think of them like peanut butter and jelly. They're always better together.
Yeah, that's a
Like
very
you
good
don't
point.
really just want to have one by itself. Together, it's going to be more magical. And that's just because antioxidants, they are all about teamwork. Like they're the ones where they say, "Oh, if this is not group work, we're not doing it." Um, because of how antioxidants work. Like an
Yeah.
example, where if we think about the cell membrane, and this needs to be like flexible and happy and good so it can let stuff in, let stuff out. You have all these unsaturated fatty acids making up this membrane. And if it's an unsaturated fatty acid, that means it's really, really sensitive to oxidative stress. And there's only 9 vitamin E molecules for every 1 to 2,000 unsaturated fatty acids. So if
Wow.
vitamin E is kind of like the fire department to try and keep the cell membrane from, getting super inflamed, and vitamin E is going to work really hard to, neutralize any free radicals or pro-oxidants. But if vitamin C isn't there to regenerate it, like think of it like a bucket brigade putting out a fire. You've got the one bucket, and then you need to have another bucket there or something to refill it. And that's how that cycle works. Vitamin E helps, and then vitamin C regenerates it, and then vitamin C is regenerated by, like glutathione. Glutathione's regenerated by NADPH. Like you just have to have them all together because I think that's why some of the studies with antioxidant supplementation are weird, is
Mm,
because like, I know they did some studies for like vitamin E supplementation and heart disease because they're like, oh, diets and vitamin E are so great for heart disease. And then they supplemented and they're like, actually, those results were really bad.
yeah.
And it's like, well, did you look at people's vitamin C status? If you just start pouring all this vitamin E in there and there's not enough vitamin C to regenerate, like you're just adding gas to the fire.
Yeah.
So, that is one thing too when I'm looking at supplementing with antioxidants or any kind of vitamins. I'm wanting to know how they work in the body so that I'm not just like pushing, one thing and not thinking about the rest of the pathways or systems they impact. And so that is one reason why I am a huge fan of food first for antioxidants because they all tend to kind of go together. Um, and support those foods really support each other well. And so antioxidants, they need to be group work.
Yeah, no, nature got it right. That whole pill for ill thing that we, get stuck into versus food as medicine. And, that's why I like herbs and things. And I don't love
Mhm.
necessarily extracts because the whole herbal complex, they say make aspirin out of willow bark and it's like the whole herb together actually negates all the side effects you get if you take that out. So yes, it's a very good point,
Yeah.
and yet you're very right. Antioxidants they're team players. It's like asking a basketball defender to go out and, I don't know, play cricket or something like that. They're like, we don't work that way. So
Yeah. So, I mean, supplements for sure have their place and really glad that we have it as a tool, but it's just, use tools the way they're meant to be used. That way they're most effective.
totally agree. Lindsay,
Yeah.
as always, it's a joy and a pleasure to have you for the first one of 2026. We'll be back to do a whole series on vitamins, but we are going to go sideways next time and talk about the pathology testing behind CKD, what that actually looks like, and when you should be concerned. So we'll do that next time. Lindsay, thank you. If you
Perfect.
want to know more about what Lindsay does, head to kidneynutritionalinstitute.org. I'll put her website up. They're running a few really cool programs. I know they're putting together some new trainings and things like that they'll be offering to the public. So make sure you jump onto their website and have a look. If you want to work one-on-one with a renal dietitian that is as fabulous as Lindsay, you can find all the booking details on kidneynutritionalinstitute.org. I'll put the link in below. If you want to know more about what we do, head to www.kidneycoach.com. You'll also find us on socials under the same bit. Make sure you hit like and subscribe. That way you'll get notified anytime we put up new content. Thanks for being part of our community. Lindsay and I look forward to seeing you next time. Thanks, Lindsay. Bye.
Thank you. Bye.